What's going on, ladies and gentlemen? It's your boy Brad back with another video, and what I want to talk about in this one are kind of my goals for 2018.
Are you listening? Nurse Pass, Beast Mode, Grinding, yeah.
So I'm playing off of Ashley Atkins' video, her goals and reflections, and I wanted to kind of tell you guys what my goals are in nursing for 2018. You know, yesterday or the day before marked my 1-year anniversary of passing the NCLEX and officially becoming a registered nurse. And it kind of got me thinking, you know, how far I've really come in such a short amount of time. This past year has come and gone, man, just like that. And I've really grown a lot as a nurse, specifically an ICU nurse in a short amount of time. But where do I plan to go from here? One of the things that I really want to focus on this year, foundationally, fundamentally speaking, of course, is continuing to better myself just as a critical care nurse in general. Continue to develop those critical thinking skills that are necessary specifically in the ICU environment so that I can better hemodynamically manage these patients and set them up for success. Now, if you didn't know, if you just started following me recently, fresh out of nursing school, whenever I became a nurse, I got hired into a cardiothoracic surgical ICU. And so we deal with a lot of patients, a lot of hearts, a lot of fresh post-op hearts who don't come to the PACU, they come right to us, and we recover them there in the ICU, get them extubated and get them set up for success. One of the big things that I want to focus on outside of just continuing to grow and develop my foundation as a nurse is to begin to work on advanced competencies. So on my particular department, we deal with LVAD patients, left ventricular assisted devices. I've gotten the education piece on that, but I want to begin to take on those kind of patient populations. One of the big things that I want to do are to begin to take on additional patient populations. You know, whenever you graduate from nursing school and you pass the NCLEX and you start working as a nurse, it's such a sense of accomplishment. But one of the things that I consistently preach and have since I was in nursing school is to never be content, to not be content with where you are. And that's kind of where I am. I want to continually, always continually grind to be better, to learn more, to gain more, to be able to do more. So the LVAD is definitely one of the things that I want to do. Just finished up some education on Impella devices, which are also left ventricular assistive devices. I'd like to begin to take on those kinds of patients as well. Additionally, if time allows and everything works out well, I'd like to begin to take on patients who need CRRT also, continuous renal replacement therapy. Like I said, just to continually attempt to grow and to continually gain more knowledge and to be able to take care of more patients. That's kind of where I'm sitting right now for 2018. A lot of things to look forward to, a lot of exciting things on the horizon, but I do, you know, again, want the takeaway from this video to be, not to be content. You know, whatever you're doing, whatever facet of nursing you're in, whatever phase of nursing school you may be in, whatever you are, whatever you're doing, wherever you are, never be content, man. There's always more to learn. There's always more to gain. There's always more to do. The day that you are content is the day that you can close your eyes and exit this world. But until then, there's work to be done. Work to be done.